Welcome back. Okay, so if you've been following news headlines, you might be wondering what vaccines are available and recommended right now. And of course, as we head into the winter months, it is time to start thinking about ways to stay healthy. So joining us now is Dr. Steve Lawrence from WashU. Dr. Lawrence, thanks for being here this morning.
Oh, good morning. Thanks for having me.
Oh my gosh. So yeah, the news headlines make it really foggy for some people, I think, because it's like, ooh, what can we get? What's recommended? So what vaccine should people be getting right now?
Well, right now, as you know, it's the start of respiratory virus season. Flu is just about ready to start, and COVID's been here for a little while. So those are two of our mainstay vaccines for the respiratory virus season. And then one that's a little bit newer for the last couple of years is the RSV vaccine for many older adults.
Oh, how old should you, or how old do you need to be, I guess, to get the RSV vaccine?
Well, with almost all of these vaccines, it really is recommended for people who are at higher risk, which we really start to say at 65 and older.
Okay, that's information I've never heard before. So that's, I mean, that doesn't mean anything. It just means I didn't know that. So thank you for letting us know. Who should be getting vaccines in general? Like who should be getting the COVID vaccine? Who should be getting a flu shot?
Well, in general, a great way to look at this is for anybody who wants to reduce their risk of getting respiratory viruses should get vaccines to prevent that risk.
Okay.
But it's really recommended for those who are at higher risk of getting seriously ill. And so it's, again, in that age group, 65 and older, but also people whose immune systems are weakened during pregnancy and anything that would, underlying heart and lung disease in particular, that would lead to higher risk of complications from these viruses.
Okay, and I always think about the flu shot. I always try to get it flu before boo. Like I always try to get it in October. Is that weird?
Oh, I love that.
Oh, you
That's
do?
fantastic.
Okay. A doctor told me that, so yeah.
That's what I recommend too,
Oh,
but I
okay.
don't use those terms. I just say
Oh.
make sure you get it by Halloween. And so, can I use yours?
Yes, of
Okay,
course.
thanks.
I love that. Yeah, so I guess do we need to, it's been, you know, it seems like it shouldn't be a surprise every year, but I'm always like, wait, do I have to go to my pediatrician to ask for all these things or do I have to go somewhere else?
Well, that's a little more complicated
Okay.
this year, and that's still being worked out for COVID in particular.
Okay.
In most years, a couple prior years, the vaccine was approved for everyone, it was recommended for everyone, easy to get, even walk into a pharmacy to get it. This year, there are some challenges with that because there's not alignment with what the FDA and the CDC has recommended, and we're still waiting for a few details. Hopefully, it will still be easily accessed by those particularly who really need it.
Okay, so do you, without putting you on the spot, is there a recommendation then if I wanted to get a COVID shot or I wanted my son to get a COVID shot who's 6, what would you recommend? I mean, it is tricky, so should we get it earlier so that, I don't know, what's the best recommendation?
Well, for the COVID vaccine in particular, where there's some of this confusion exists, it is going to be a case where if you've been advised to by a clinician, then it does make it easier because that's what the CDC advisory committee has recommended. And then it's just a matter of right now, some of the pharmacies are still working out whether or not a prescription would be needed or not. And so some of those details I hope are going to be resolved in the next day or two. But the bottom line is that what hasn't changed is that there are still people who need these vaccines.
Sure. Oh my gosh. Okay, yeah, that must be so confusing for people in your profession and also for patients. How can people stay vigilant with getting information that doctors and scientists recommend? What is the best way? Because there is so much noise out there.
There sure is, and that's actually a little more challenging this year too, unfortunately, because most people, we would recommend just taking a look at, say, the CDC website because it had always had accurate, up-to-date information. That's a little bit of a challenge this year with some of the changes that have been occurring. And so one thing that we also have been recommending are people go to, one, their own doctors if they can, but not everybody has access to a physician or somebody who can give them good advice. And in those cases too, we recommend reputable sources, particularly some of the medical society professions, things like the American Academy of Pediatrics and some of these other organizations that at least are giving recommendations based on science from experts who really know what they're talking about.
Okay, yeah, we do actually use that quite a bit in our newsroom, but there is a lot of conflicting noise is the best way I can say it, because there is so much confusion on, okay, what should I do as a parent? What should I do as an individual? I'm sure you're getting that too.
Oh,
Yeah.
all of the time. And unfortunately, there is disparate messaging right now, and so it is important to really go to trusted sources. And again, your own clinician or provider if you have one, and if not, perhaps even places like the media here.
Okay, yeah, okay. Well, yes, we do trust scientists, so thank you so much for being here this morning and for all the work that you do. So flu before boo.
I love it.
Thank you, Dr. Lawrence.
Thank you.
All right, let's get on over to